Hi, we are in a new program of Healthy Life. Today we have a very special guest in our studio who is from Africa, indeed, from Sudan. He's a very good friend of mine. He's a very old friend of mine, indeed, over 30 years, in about 40 years. We have played football with him. We have walked around, we have gone to the lectures and done lots of things with Hatim Yahya. He's a very successful surgeon, a general surgeon now in Turkey, performing very successful surgeries and has lots of patients from all over the world. He's dealing especially with abdominal surgery and transplantation surgeries, also other surgical procedures. Today I think we'll speak about gallbladder, but let's hear something from you. Who are you? Can you introduce yourself to our audience? Of course, I know you very well.
Thank you very much for Nature TV and for one of my best friend and old friends, Professor Serdar. So as he said, we have been here for long and we lived together for a very long period of time. Originally, I'm from Sudan. I came here about 35 years ago, and we studied together, and then I settled down in Turkey. I specialized in Ankara University, and then so on until I became an academician in top university. So I would like to thank them again and thank you very much for this chance that you have given to me.
That's our chance indeed, and of course all the chance of our all audience to hear valuable information from you. Today we'll speak about gallbladder.
Yes.
What's gallbladder? Where is it located? What does it do? Is it necessary really?
Yes, of course, a gallbladder, when we talk about its anatomy, I mean location, it is located on the right upper side of the abdomen. It is just below, under the liver, and it is a storage organ. In fact,
what does it store?
It is store bile. Of course, bile is, of course, made in the liver, and it is from the liver, it goes to the small intestine, the first part of the small intestine, and before it goes to that part of the body, when there is lots of bile production, the more of bile goes to the gallbladder, and it is storage over there until it is needed.
What do we need bile for?
Yes, bile is needed for the digestion of fats. So yes, so it is very important, and it consists one of the main digestion materials or substance for the body.
For the body. If there was no bile,
yes,
what would happen to the lipids, the fat?
Yes. If there is no bile, so the patient will get too many problems. One of them, the patient will have diarrhea due to what? Due to the non-digestion of the fat materials. Yes. Second, you know, we have some of the vitamins that A, D, E, and K that they are absorbed by the help of the fats, and since fats are not absorbed, so that means there will be a deficiency in those vitamins.
Yeah.
Yes.
And this will cause significant problems.
Yes.
Thus,
yes.
every organ is needed in the body and
yes.
have a function.
Yes, as a function, of course.
Okay.
Of course.
What are the diseases of gallbladder?
Yes, why, thank you very much for this question. Why I have chosen gallbladders, because one of the main surgeries, common surgery that has been performed in general surgery practice. The most common disease or problem of the gallbladder is formation of calculi or gallbladder stones. Yes, yes, this is the most important problem. And with this problem associated some other problems like what we call the cholecystitis, which means the inflammation and the infection of the gallbladder. Beside this, we can see what we call cholangitis. That means the infection of the gallbladder and the common bile duct. Yes.
The path between gallbladder, small intestines and gallbladder. Yeah.
Yes, 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 yes.
You said there's inflammation.
Yes.
Is it a serious problem?
Of course. Of course.
What does it do?
Of course. It is. It is in fact. When calculi forms in the gallbladder, they may obstruct the gallbladder duct and then causes what acute cholecystitis. It has a very common symptoms. These patients, they have right upper abdominal pain. It is a sharp pain which maybe goes or approximately goes to 1 hour or at least half an hour. And yes, and beside that, some patients may have nausea associated with this pain. This pain is recurrent pain because most of the patients, they don't have idea about having gallbladder stones, and because of that, they think it is a stomachal problem or a problem related to the stomach, and they have some medicine. When they have this medicine, they have a little bit, they become comfortable, and because of that, they don't go to the doctors.
Yeah.
If this problem is not treated, as I said, calculi are formed in the gallbladder. The size of calculi differs. Some of them, they can be as big as 8 centimeters in
8 centimeters.
Yes, in length.
Really?
I had a patient like that.
Whoa.
Yes, 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 my dear friend.
Did you say him that you have a gallbladder besides the stone?
Yes. In fact, that stone full the whole gallbladder. We didn't have any place to pick the gallbladder and to stretch it until I put on a stitch, and we hold it from that stitch.
For convenience, may I ask, what's the normal size of gallbladder?
It is about, in fact, the size is about 8 to 7 centimeters in length and 3 to 4 centimeters in width. But this depends from patient to another.
Yeah,
yes,
yeah.
Yes.
It depends on the bile amount and fasting or
yes,
after
yes, yes.
meals.
So in case of small calculi, what we are afraid of and what we ever want it to happen is this: the small calculi can drop into the gallbladder duct, and from there to the common bile duct or to the coloduct, and from there to the duct or the where it opens with the duct which is coming from the pancreas.
Do we see all these structures in that slide?
Yes, right, we see.
For convenience, can you show them and show the pathology? Because this will make, I think, more sense when you show what's going on over there. I think the uppermost bigger structure is liver.
Yes, it is a liver. and just below the liver there is a greenish structure. The greenish structure below the right side of the liver is the gallbladder, and you see two ducts coming from the liver, one from the left side of the liver, what we call the main left bile duct, our hepatic duct, and the other from the right side, what we call the right hepatic duct. They come together and join just at the entrance of the liver, and when they join, we call the common bile duct. Then after 2 to 3 meters distal or below, it joins the gallbladder duct, and then together 3 of them are called the coloduct.
Coloduct.
Yes, yes.
These are indeed pathways
Yes.
that bring bile from liver, where it is produced, to
Yes.
the gallbladder
Yes.
and also to the intestines.
Yes.
Okay.
Yes.
Then
Yes.
3 structures are combined together.
Yes.
Small intestine, bile, gallbladder, and
Yes.
the liver.
Yes, right.
And any stone
Yes.
here may
Yes.
may obstruct this
Yes.
path,
Yes.
thus cause indeed significant problems.
Yes.
The patient may awake in the middle of the night
Yes.
with severe pain
Yes.
and leave the room and
Yes.
go to the hospital.
Yes,
This
right.
may be so severe.
Yes.
Oh,
Yes.
okay.
Yes. Yes. And also, it might cause what we call obstructive jaundice. If the size of the calculi is enough to obstruct the whole width of the common bile or the coloduct, it might cause what we call the jaundice, obstructive jaundice. Yes.
Why does this jaundice occur?
Because no bile is going down to the small intestine. Because of that, the bile, what we call bile pigment, are absorbed by the body into the blood, and then the bilirubin, which is one of the bile's pigments, it increases in the blood, and then when it passes a certain level, that was about 2 milligram in deciliter, then firstly it occurs in the sclera. The sclera became a little bit yellowish. Yes, yes, it became yellow, and this might give us that this patient might have obstructive jaundice. Yes. Yes.
And then shows you to look after gallbladder region for any obstructive signs and symptoms.
Yes. Yes.
Okay. Why do these gallbladder stones form? Do they form in everybody?
Most we have the common, what we call the 4F, that these gallbladder stones form mostly in females that are above 40, and they are fat or they have big size. And when you go to the western side, you see that, or western side, that they are fair.
What?
Fair in color. So that
I see.
These are the
I
common.
have 3 of these.
Yes.
I'm not female, but I have 3 of them. Okay. I'm lucky. Just
yeah. And depending on the function of the gallbladder, we have 4 common functions. So if one or more of these functions is not doing well, so the calculi can form. These are work at the storage organ, then it secretes what it is inside it, and also it secretes a material which it protects the inside of the gallbladder, and also can absorb the bile from the bilirubin from bile. If one or two of these functions are not doing well or are not efficient, then gallbladder calculi can form. Besides of this, the amount of water consumption and the amount of cholesterol in the body, and also some related diseases like hemolytic anemia or sickle cell anemia, where blood are more destroyed than normal. So this can lead to the formation of what we call black stones in the gallbladder.
I see.
Yes.
So hemolytic anemia patients
Yes.
must be frequently followed up for
Yes.
the presence of gallbladder stones. Is there any way we can prevent production of gallstones?
In fact,
you said having significant amounts of drink lots of water.
Yes, yes. This is why, because of the concentration of bile. You see, as bile is so concentrated in the gallbladders, that means the running way of the fluid may be a little bit obstructed, or the consistency is more
viscous.
More viscous. When there is more viscous, some of the materials can be a little bit together and
saturated
yes,
to each other.
Yes, and
rough,
starting to form small calculi, and this with time will come and become bigger. So this can be necessary for some patients, and also we want to reduce the amount of cholesterol and lipids, because we have also white stones which are formed from the cholesterol and lipids. So
again, we can be the same problem.
Yes,
Don't become
yes,
obese.
Yes, yes.
Do eat less,
Yes.
and do move more.
More, yes,
Yeah.
yes.
This also prevents the production of
Yes.
gallbladder stones.
Yes, yes,
So,
yes,
so having weight is harmful in every aspect.
yes.
Don't gain weight like me. Don't like me. And try not to be over 40, not to be female.
No way out.
Yeah, there's no way out. Of course, these are not our choices. We will age, and then we have some factors that we can change.
Yes.
We can move. We
Yes.
can take care of what we eat,
Yes.
and we can move more
Yes.
and
Yes.
drink lots of water.
Yes.
Do you advise just water, or other fluids are also effective? Some people like to drink alcohol. Does it help, or does it adversely affect?
As you know, consumption of alcohol is harmful for the body.
Sure.
Mostly.
In every aspect.
Yes,
it's
in every aspect. Consumption of alcohol is not helpful in this case, because it has a diuresis. What we said we should consume much of water and what we call soft fluids. When you consume alcohol, so you pass too much water, and that may lead you to dehydration, which is just the opposite and the contrast of what we want.
Yeah.
Yes, in the case
This
of
may indeed increase the production
yes.
of gallstones.
Yes.
Thus, fluid with less diuretic effect
Yes.
will be affected, and that's water. Okay. We have learned what we have to do to prevent the gallstones. What can we do for its treatment if we couldn't prevent them?
There is only one treatment. Some of the patients, they got confused between the treatment of gallbladder stones and kidney stones. Gallbladder, anatomically and physiologically, is quite different from the kidney, because it has got a very thin wall, and the only way of treatment is surgery.
I see.
That means it should be operated.
Operated.
Either by an open surgery, which is almost, we forgot it because laparoscopic surgery is so advanced in Turkey. So about 99.9 of the patient are operated through laparoscopic techniques. That with 3 or 4 holes, and we don't use the open or classic surgery unless there is some other problem that force us to do that.
I see.
Yes.
You almost always prefer laparoscopic surgery.
Yes.
It's easy to perform.
Yes.
It's very comfortable for the
For
patient.
the patient. Yes, right.
There are less side effects,
Yes.
and it's quite effective.
Yes. Yes.
That's very good. We will talk some more details
Yes.
about this treatment and maybe other options
Yes.
After a small break.
Right. Thank you very much.
Thank you. Hi again. Here we are together with Dr. Hatim Yahya talking about gallbladder diseases, and we are in a significant point. The patient had gallbladder stones, had severe pain, nausea, vomiting, couldn't eat, and came to the hospital, and physicians diagnosed the patient as having gallbladder stones with acute cholecystitis.
Yes.
In this condition, when the patient has acute cholecystitis, do you wait for some time or do you immediately perform a laparoscopic gallbladder surgery?
In fact, there is 2 views. The older one, when I was an assistant, I remember, they used to what we call make the condition become colder.
Yeah.
What do I mean by that? That it means we do not operate on the patient immediately. That the patient is given antibiotics. The patient is stop having oral intake, yani no food, no water, and giving him some kind of fluid through the IV or through the IV way. And then after that, the patient is sent home for at least 2 months, and then after 2 months, the patient can be operated on, which is, according to me, it is a time-consuming, and also it is a little bit expensive, and at the same time, it is a little bit harmful for the patient because the patient would not be able to eat something for at least 4 to 5 days.
Yeah.
What I like, which is in my view, the way that it should be done, unless there is something that obstruct or something that prevent this way of treatment from being doing, which is immediately operation at the time of the diagnosis, particularly the first 2 days, because that time it is easier to operate on the patient, and complications are a little bit less or almost will not appear. And the following day you send the patient to his house. Yes.
That's very
so this is a way which I prefer to deal with acute cholecystitis.
Yeah. This is acute cholecystitis, but I think you don't see the patients in acute conditions. Indeed, you see patients that are accidentally found to have gallbladder stones when examining something else. For example, when for steatohepatitis or another thing, the radiologist observes a stone in the gallbladder.
Yes.
Do you operate every stone?
In fact, as I said, there are some differences in the way the centers and that they approach this condition. most of these patients, in fact, they have problems and they have symptoms of gallbladder stones. If you go deep and ask them,
What will you ask them?
what we ask is this. They tell us, in fact, when they say, no, I have no problem with my gallbladder stones, when you go and ask him, for example, you say, sometimes do you have any kind of problems like some problem related to digestion after meals?
Especially
or,
fatty meals.
Yes, fatty meals or egg. I mean, they look, you say, yes, sometimes I have, but it is not because of the gallbladder. In fact, it is because of the oil that they have used. I'm not used to that oil. Or sometimes when you go deep and ask about whether they have some kind of dull pain over the upper right of the abdomen, they say, yeah, from time to time, but not
This
all
side,
the time. Yes, yes.
Okay.
Or they say, I have problem, but in fact it is not related to the gallbladder, it is related to the stomach, and that time I have some kind of pills to relieve the pain. In fact, this person, what we call, he have clinically significant gallbladder stones symptoms, but himself is not aware of that.
Aware of that.
Yes, he's not aware of that. When we go deep, we find this patient have significant gallbladder stone symptoms. Then we call him for, or we request for operation, and we give him our opinion. If he agrees, we operate on him. There are some other patients, in fact, really they don't have any, what we call silent gallbladder stone. No symptoms at all.
Yeah.
When you go and deep and have a history of the patient, you find that he has none. So this patient, it depends on their health condition.
Yeah.
So if you think, because we don't know when the symptoms will come out.
Yeah.
It may come out immediately the following day. It may come out after 1 month, 1 year, 10 years. But as generally, you evaluate the patient, and if you think in the future this patient have some diseases, comorbid diseases, that with time might affect your outcome of the operation, that time we talk to the patient. Like if the patient has uncontrolled blood hypertension, or if the patient have uncontrolled diabetes mellitus, particularly this patient with uncontrolled diabetes mellitus, they do not show the cardinal symptoms and signs of gallbladder stones, although they have it.
This is very important.
This is very important.
Diabetes patients may have no symptoms, but have severe
complications
with gallbladder stones.
Yes.
What are those complications?
What is mostly with this patient, they may have MPM, what we call formation of pus inside the gallbladder.
A very severe kind of infection inside the gallbladder. And this is life-threatening.
Yes, of course. It may lead to sepsis and septic shock. Secondly, this patient, they have what we call fistulization. That means the gallbladder will come and open into some other organ.
Oh.
Yes, like the stomach, or open into the abdomen, into the abdominal wall, come outside of the abdominal cavity.
And
or
what will happen after then? The bile over there will begin to digest the abdomen,
In fact, in those patients, they become seriously ill, and they will lose weight, they will not eat properly or feed properly, and then the procedure that we're going to perform will be a little bit complicated, and those
patients... A little bit or much more complicated?
I
think much more,
Yes, much more complicated, and as I said, over a night we discharge patient with laparoscopic cholecystectomy, but these patients, they have to stay at hospital, and they have to have antibiotics treatment for at least 5 to 7 days. So when you compare this patient to the normally or to the patient that operated without complication, there is much more difference between the two conditions.
Yeah. Thus, if a surgery is recommended for a stone, it will be best for the patient when he or she does not have any symptom. Come to the doctor immediately,
yes.
have your operation and go to your home the
yes.
next after.
In fact, we should give him information about the condition, and then we leave the choice for him or her.
Sure.
So this is a condition. This might happen or might not happen. If this happens, so and so will come out, and you decide.
Yeah.
The decision is yours.
I'm stressing this because indeed the father of a friend had the same unfortunate course. He had a complicated gallbladder stone diseases, then developed an emphysema, then developed sepsis, and unfortunately he passed away.
I see.
This was a very unfortunate condition.
Yes.
And as you mentioned, it could be prevented if it was found earlier with having no symptoms and having a very simple surgery. Like that. We hope you do not ignore this significant condition and have whatever treatment you are offered, discuss yours with your doctor and decide whatever you want to do.
I want, my Dr. Serdar, I want to mention something which is a little bit important according to me.
Sure.
This is this. Too many people, without consulting doctors, without going and see doctors, they say, I have stomach problems, and because of that, you see the use of this anti-ulcer treatment is so common. So these people, most of the patients, they use these pills and this treatment without any consulting any doctor. This might hide the condition. So and this may bring out what we have talked about, these complications. So I want the patients to be aware of this. Not take pills or treatment without consulting your doctor.
Especially which pills?
Especially what we call
ulcer pills?
Ulcer pills, of course. And painkillers.
And especially painkillers.
Painkillers, yes. Yeah. Painkillers. Because when you don't have pain, in fact, the feeling that Allah have given to us, which is very important. If you don't have pain, you don't go and see doctors. If you don't have pain, you think that you have nothing, everything is all right. So this is important.
Before 30 years, 30 years ago, when I was in medical school, my teachers told me something. Do not take a painkiller medicine when you have an abdominal pain. Is this true still?
This is still true, and it will be true in the future. We only give a patient with abdominal pain, we give him painkiller when the diagnosis is proved. I mean, this patient, too many pathologies can produce or can lead to abdominal pain. So when you put the right diagnosis, then you can start having or giving the patient painkiller.
I think very important. Because the abdomen is indeed a closed box. You don't know what's going on. There's some pain, but there are lots of organs which may cause pain over there, which may, some of them may be very, very important and life-threatening. Indeed. Thus, you have to find where this pain comes from and treat your direction according to that. This is very important.
It is.
Thus, please do not take any painkillers if you have an abdominal pain, and visit the closest doctor you can go. This way you will be very safe. You will be followed up and treated accordingly.
Accordingly, yes.
There are lots of reasons. We are just talking about a small, very small organ in there, over there.
Yes, yes.
There are lots of reasons you may have a
it is about
problem.
10 cc or mostly 10 to 20 cc in size.
Again, maybe we can stress the two situations differently. The first scenario is you have a silent stone over there which may obstruct, and you go to the doctor. Doctor offers you a simple surgery. You have that surgery and go home the next day.
Next day, yes.
This is the first.
This is, yes.
The second scenario is you don't care about your stone disease.
Yes.
You have a significant effect.
Yes.
Attack of gallbladder inflammation. That's cholecystitis. Your gallbladder may rupture.
Yes.
And may cause sepsis.
Yes.
And you may die because of multi-organ failure.
Yes.
These two scenarios are extremely different.
The
first one was very easy to treat.
Very easy. Yes.
Very easy to handle.
Yes.
Very cheap indeed. Yes. The second one
is
cost your life.
Is a disaster.
It's a disaster.
Yes.
And please do not ignore this symptom. And if accidentally you have been found to have a gallbladder stone, please visit a general surgeon. If you are here,
again,
you can visit Dr.
again, Professor Serdar really remind me of something. That is, if you have recurrent pain, or if you have any recurrence of any kind of symptoms, please do not ignore these. Go visit your doctor and try with him, or he will try to find out why you have these symptoms.
Recurrent
because
pain.
This is also very important, because this might showing something which is when you deal with it earlier, you can get rid of the disease or what causes this pain. But if you go late, time will be so late, and there could be nothing to be done. So I want the patients to be aware of this.
What do you do if you find someone who has a gallstone? Do you take the stones?
No. As I said before, I said this is where some patients are confused, because, as you know, in the case of kidney stones or uretary stones, they have some way of picking these stones without harming or without taking the organ out. I mean, without taking the kidney out. But this is not the case in the gallbladder. Sometimes, yes, stones should be taken out when the stone drop from the gallbladder to the common bile duct and to the ampulla water, where the duct coming from the pancreas and the coloduct come from the upper side from the liver, and they join in the first part of the small intestine. So a stone, when it drops there, it obstructs this passage of both bile and pancreatic secretion. So then they should be performing an endoscopic form of taking this stone out. When this stone is taken out, this will not prevent the surgery of gallbladder. After taking this stone out, then gallbladder operation will be performed. Why this way? Because the doctor or the one who is performing this endoscopic extraction might not happen to do it endoscopically. So it may fail. He could not be able to do it so that time we do it either laparoscopically or with open surgery. Yes.
Open surgery.
Yes.
Yeah, that's very good. You said there's also an endoscopic way of doing it.
Not for the gallbladder stone.
Just the stones that have come near to the small intestine.
Yes.
At the edge of that small intestine. then they made
Yes, what we call
an option.
colloidal stones.
But this will not prevent cholecystectomy. The gallbladder
Never.
will anyway be operated
Yes.
and taken out
Yes.
because it has caused
Yes.
stones, and
Yes.
it will most probably cause
Yes.
other stones, and
Yeah.
this condition may be life-threatening,
Yes.
and you can treat it easily,
Yes.
very cheaply, and effectively.
Yes.
But you will take the gallbladder.
Yes. The whole gallbladder will be
Yeah.
taken. Yes.
Is there any problem with that?
In fact, no. Most of the patients, they are very afraid of having some problems after the gallbladder is taken out. Let me put this way. The gallbladder, these patients with gallbladder calculatory stones, they have no efficiency working gallbladder.
Yeah.
So,
Yeah.
since it is not working efficiency, so that means it is not doing its job.
I see. When you take it out,
Yes.
where will the bile go? Directly to the small intestine?
Directly to the small intestine, and according to my experience and my observation, even most of my patients, we don't give them special diet after cholecystectomy. Yes.
Okay.
But some patients, because they have other problems,
Yeah.
I mean, we should figure out whether this patient problems or symptoms are related to gallbladder stones, or he may have two pathologies at the same time.
At the same time.
Yes. So he may or she may have stomach problems, and at the same time gallbladder stones.
I see.
So in this case, we do more examinations, and then after that we
over there.
Yes.
Dr. Hatim, indeed, this is a very fruitful conversation with you.
Thank you.
And this is the end of our time now.
Thank you.
Do you want to add any other thing for our audience from Africa?
In fact, yes, I want to say, wish everyone good health. And as we said, alcohol consumption is really harmful for our body. I want them to be far away from alcohol consumption. And I want to tell them that this country is a very helpful country. And I have been here for long, and I have children from a Turkish lady, and I haven't feel like a foreigner in this country at all. So all of them, they are welcome. If they have any problems, they will find Turkish doctors, Turkish people very, very helpful. This is what I want to tell them throughout my 30 to 35 years stay in Turkey.
It has been very delightful to see you.
Thank you very much.
For over 35 years in
Thank
Turkey.
you
too.
very much.
Dr.
Thank
Hatim.
you very much.
Thank you very much for everything. And
Thank
Africa.
you.
Have a
Thank
nice
you.
day. But promise me one thing. You
Yes.
will come again here.
Again and
Talk
again.
about anything.
As much as you want.
Okay.
I'm
Have a
at
nice
your
day.
service.
Thank you very much.
Thank you. Thank
Have a
you.
nice day, Africa.
Hello, everyone. Hi. Okay.